Hello, I'm Minnesota Commissioner of Health Jan Malcolm. Lately, we're all hearing a lot about a new outbreak associated with a respiratory illness called novel coronavirus. This outbreak started in China and now has spread to several other countries, including the United States. This novel coronavirus causes respiratory illness in people, and it can spread from person to person. Symptoms of this infection include fever, cough, and shortness of breath. And while most people do recover, it has led to serious illnesses and even death in some cases. Minnesota's public health community is working hard to protect you. And we're asking for your help by following the same basic precautions we all use to prevent colds and flu. It's really pretty basic. Wash your hands often and well with soap and water. Cover your cough every time, and stay home when you're sick. Also, if you've recently traveled to a country like China where this novel coronavirus is spreading and you have symptoms, it's really important for you to call your doctor or your healthcare provider to let them know not only about your symptoms, but your travel history. They'll work with you to assess your condition and make sure you get any treatment you need, while also limiting the risk of passing along an infection to other people. We in the public health field are learning more about this outbreak all the time, and we will share key information with you as it continues to evolve. You can always stay up to date by visiting the Minnesota Department of Health website, which is health.state.mn.us. Thank you, and stay well.
Pay It Forward is a unique initiative that we've launched in the wake of the myriad crises that we're facing as a community. We know that literally every business in our community is struggling right now. Every business, and our small businesses are a part of the fabric of who we are as a city. So helping each other get through this moment is helping St. Paul get through this moment as well.
Pay It Forward is just a way to connect business owners with the resources they need. The beautiful thing about it, though, is the partnership with SCORE helps us to create an infrastructure where, on a longer-term basis, volunteers with technical talent can support small business owners in their day-to-day needs. So it is a matchmaking service, if you will, for entrepreneurs and those who want to help and be on the front line in order to answer questions and be able to serve as a resource.
Cities and states and counties and federal level programs and fundings are coming down the pipeline so fast that what we're running into is a lot of problem with people who have the language barrier or the technical barrier. And some of the needs that we have right now are to help people navigate those systems.
We have seen that because Ramsey County comprises so many small businesses, in fact, with under 20, many under 5 employees. Those businesses, who are largely businesses of color and low-income individuals, have struggled to be able to sustain the pandemic.
St. Paul is unique in that we're a city, but we're small enough where we know each other, we care about each other. We understand that if Frogtown does well, then Highland does well. If the East Side does well, then Midway does well, because all of our neighborhoods are intertwined and linked together.
I think we have to think about this not as a moment of helping restore or rebuild and heal Minnesota, but think about what is our long-term investment in these businesses and in these communities. It's not about a moment, it's a movement, and it's about what we're doing differently to support these businesses.
And to any business owner, if you are out there feeling confused, struggling, you're not alone. So many other business owners are in your position right now, and Pay It Forward is here to help.
If ever there was a time to lean in, the time is now. This is the time for all of us to pay it forward, and this is the time for all of us to leverage the resources that are available so that tomorrow will be very different than today.
My name is Chris Eiersman, and I'm the Director for Infectious Disease at the Minnesota Department of Health. I know that COVID-19 is on everyone's minds. Slowing the spread of COVID-19 is vital for protecting our communities. Right now, it is important for people to cancel large gatherings and practice social distancing. And what this means is making sure that you're maintaining a distance of about 6 feet between people. Continue washing your hands, covering your cough, and cleaning frequently touched surfaces. Stay home when you're sick. I'll say that again. Stay home when you're sick. That is the most important thing. We know these recommendations mean disruption to your lives, but they are so important. We need to slow the spread of the virus so that we don't overwhelm our hospitals and clinics. Thank you for doing your part. If we work together, we can manage this situation.
Cómo lavarse las manos correctamente durante 20 segundos. Enjuague las manos con agua tibia. Aplique jabón suficiente para cubrir toda la superficie de las manos. Frote las manos palma contra palma. Frote el dorso de una mano contra la palma de la otra, entrelazando los dedos. Frote las palmas de ambas manos con los dedos entrelazados. Doble los dedos de una mano y frote las uñas con la palma de la otra mano. Agarre el pulgar de una mano con la otra y rótelo en movimientos medio circulares. Frote de arriba hacia abajo la punta de los dedos de una mano contra la palma de la otra mano. Enjuague las manos. Seque las manos con una toalla limpia. Cierre el grifo con la toalla. Ya tiene las manos limpias.
The stay-at-home order asks all Minnesotans to avoid going out in public unless it is absolutely necessary. By staying at home, we can slow the spread of COVID-19 and help save lives. It protects the people who have to go out, and it gives our healthcare system time to prepare to care for people who get really sick from the virus. We may leave our homes to pick up essentials like groceries, medicine, and gas, or to get medical care. And if our job is to provide a critical service like healthcare, law enforcement, childcare, or groceries, we can still go to work. We can even do outdoor activities like walking our pets, hiking, running, hunting, or fishing, and take care of family, friends, and pets. Just remember to keep 6 feet of space between you and another person if you have to leave your home. Together, we can help slow the spread. Stay home, Minnesota. For more information on Minnesota's stay-at-home order, visit mn.gov/governor/COVID-19.
That's sent out through Cablecast.
So right now I can't pin Councilmember Prince. It's gray. I'm not able to do that. Is there a reason why some would be pinnable and some wouldn't?
I just stopped sharing my screen.
Hello, I'm Minnesota Commissioner of Health Jan Malcolm. Lately, we're all hearing a lot about a new outbreak associated with a respiratory illness called novel coronavirus. This outbreak started in China and now has spread to several other countries, including the United States. This novel coronavirus causes respiratory illness in people, and it can spread from person to person. Symptoms of this infection include fever, cough, and shortness of breath. And while most people do recover, it has led to serious illnesses and even death in some cases. Minnesota's public health community is working hard to protect you. And we're asking for your help by following the same basic precautions we all use to prevent colds and flu. It's really pretty basic. Wash your hands often and well with soap and water. Cover your cough every time, and stay home when you're sick. Also, if you've recently traveled to a country like China where this novel coronavirus is spreading and you have symptoms, it's really important for you to call your doctor or your healthcare provider to let them know not only about your symptoms, but your travel history. They'll work with you to assess your condition and make sure you get any treatment you need, while also limiting the risk of passing along an infection to other people. We in the public health field are learning more about this outbreak all the time, and we will share key information with you as it continues to evolve. You can always stay up to date by visiting the Minnesota Department of Health website, which is health.state.mn.us. Thank you, and stay well.
Pay It Forward is a unique initiative that we've launched in the wake of the myriad crises that we're facing as a community. We know that literally every business in our community is struggling right now. Every business, and our small businesses are a part of the fabric of who we are as a city. So helping each other get through this moment is helping St. Paul get through this moment as well.
Pay It Forward is just a way to connect business owners with the resources they need. The beautiful thing about it, though, is the partnership with SCORE helps us to create an infrastructure where, on a longer-term basis, volunteers with technical talent can support small business owners in their day-to-day needs. So it is a matchmaking service, if you will, for entrepreneurs and those who want to help and be on the front line in order to answer questions and be able to serve as a resource.
Cities and states and counties and federal level programs and funds and fundings are coming down the pipeline so fast that what we're running into is a lot of problem with people who have the language barrier or the technical barrier. And some of the needs that we have right now are to help people navigate those systems.
We have seen that because Ramsey County comprises so many small businesses. In fact, with under 20, many under 5 employees, those businesses, who are largely businesses of color and low-income individuals, have struggled to be able to sustain the pandemic.
St. Paul is unique in that we're a city, but we're small enough where we know each other, we care about each other. We understand that if Frogtown does well, then Highland does well. If the East Side does well, then Midway does well, because all of our neighborhoods are intertwined and linked together.
I think we have to think about this not as a moment of helping restore or rebuild and heal Minnesota, but think about what is our long-term investment in these businesses and in these communities. It's not about a moment, it's a movement, and it's about what we're doing differently to support these businesses.
And to any business owner, if you are out there feeling confused, struggling, you're not alone. So many other business owners are in your position right now, and Pay It Forward is here to help.
If ever there was a time to lean in, the time is now. This is the time for all of us to pay it forward, and this is the time for all of us to leverage the resources that are available so that tomorrow will be very different than today.
We're getting a little Microsoft Teams training. We're converting over to this platform today for the first time. So I think we've had a lot of practice using it, but we'll see how it works in our formal council meeting. So you're our guinea pig. Sorry to tell you. So for this PCR update and check-in, it was wonderful to have you here for this. And but forgive us if we're a little clunky. We're just kind of using this new format. So welcome. I will call the meeting of the St. Paul City Council Org Committee to order. We have on our agenda today, I believe, 2 items. One is to get an update from PCARC. The other is to discuss follow-up work on the resolutions. We had requested that the city work with the HERO department on creating some guidelines for resolutions that are kind of beyond the scope of city work, but are important from a values perspective for the council. So there's been the legwork has been done on that, and we'll check in and see what we think about what's being proposed so that we can make decisions about moving ahead with those types of resolutions. So, and I believe that is all. I don't think we have a catch-all piece at the end of this meeting. I will remind council members that next week we are hearing from Public Works. Our long-awaited snow plowing check-in will be coming our way. We decided that we wanted to talk about plowing when it was beautiful and sunny outside instead of when it was 10 feet of snow and a lot of stress and consternation, just so we could kind of do a check-in, figure out what we're doing. And so that will be coming our way next week. So without further ado, I believe we have Julian Roby from PCARC, manager, director. You're going to have to correct me with your title.
Coordinator.
Coordinator. Commander. And let's see, we have Val Jensen from HERO, director of HERO. And hello. And I believe that is who is with us today to present. Might be missing people again. We're just getting used to this format. Okay, great. So why don't I just, I guess just the tiniest bit of background is that, there's been a lot of changes in PCARC over the past couple of years. And when we have changes and transition, it's always a practice of this council to check in with departments or programs and see how things are going, what things are going well, what things maybe need to be revisited, and just kind of a chance for us to, get a glimpse into the work that you're doing on a regular basis. We know it's very important work. And without these kind of check-ins, it's hard for us to know what's going on and what are the successes and challenges that you're facing. So it's wonderful to have you here for this update. Typically what we'll do is we'll just ask questions along the way. So I may interrupt you. I'm not intending to be rude, but sometimes it's easier to just ask the question during your presentation. And if there are things that can wait till the end, we'll wait till the end and ask you. But welcome. Thank you very much for being here today. It's wonderful to have you.
Awesome. Thank you. Thank you all for having me. I'm going to share my screen. Can you all see that? Can everyone see that?
Yes. Yep, I can see it.
Awesome. All right. So just going through our agenda, I'll start with our composition, who's on our commission, go through our data, 2019 data. And I should forewarn you, our annual report has not been released yet. So this is the first time the public will see this data. We're ready to release that data into our annual summit, which will take place later this fall. I'll get more into that later in the presentation. Then I'll go through our committees, some successes that we've had since our last check-in, areas of improvement, future plans, and the response to the George Floyd incident in Minneapolis earlier this summer. So starting with our composition, the PCARC is supposedly comprised of 9 individuals that represent the diverse body of the city of St. Paul. Currently, there are 2 vacancies. However, I'll go through each commissioner in the ward that they represent. So first we have our chair, Sierra Cumberland. She's represents Ward 5. Our vice chair, Travis Grundy, he represents Ward 7. Commissioner Eric Forstrom represents Ward 4. Commissioner Charles Deneen represents Ward 4. Commissioner Jilla Nadimi represents Ward 4. Commissioner Alex McGamby represents Ward 4. And Commissioner Stefan Landro Balenga represents Ward 1. This time a year ago, we had 4 vacancies on the board due to 2 commissioners who resigned last June. A commissioner fortunately moved out of state to take another job, and another commissioner decided to dedicate more time to a campaign. All these commissioners were replaced this past winter when 4 new commissioners were trained and appointed. In June, we had a commissioner resign due to moving out of the city of St. Paul, unfortunately. And as of Friday, we had a commissioner in their first term came to an end, and they decided that they would not seek reappointment. So we are currently interviewing and doing some outreach and trying to find a decent candidate pool and fill those vacancies as soon as possible. Our data. So the PCR saw an increase in reviewed cases. Oh,
Can I just quick interrupt you? Maybe this is stating the obvious, but if we have candidates that would be a good fit for PCR, should we just send them your way? Or do you want to send a link out for us? Or how would you like us to share candidate information? It looks like Ward 4 is very well represented on PCR, which is awesome. But is there a way that we can share suggestions with you for other commissioners?
Definitely. You can email me directly. I can send everyone the link to the application to Granicus, and they can apply there. And then once they complete their application, I'll receive an email, and I can review the application and send it for when we start scheduling interviews, start contacting people.
Great. And that would be sometime in the next few months?
Yes. Hopefully before the end of September.
Okay, great. Ms. Prince.
Yeah, and Mr. Roby, to that point, I did get some feedback in anticipation of our having this meeting with you today. I received some feedback about concern that, to President Brenmoen's point, that the geographic representation could be better, and that we don't have an Asian representative on the commission, and also that we look for a socioeconomic mix. That was also suggested. So I will definitely be helping to find potential members of the commission. And also to that point, and maybe this is too soon to bring this up, but the period of time, if you'd rather defer this question if it's part of your presentation, the period of time that it takes to orient a new commissioner, I understand is significant because they have to go through the police academy. And so I wonder what we could be doing to kind of develop a bench for people who are interested in both being part of the police civilian academy just because of interest, but also our potential PCR applicants going forward, so that we might have a way of being able to recruit people directly onto the commission when vacancies open up.
Well, to the second part of your question, I do mention that later when I go through areas of improvement. But thank you for bringing that up regarding recruitment and like having a decent candidate pool. I would suggest just making sure people get through the police academy prior to maybe applying. That helps a lot because that's generally the largest barrier for people to serve on the board. So you can be appointed, but you can't actually vote until you actually complete that academy and go through that rigorous training. Takes about 40 to 50 hours of training. And it's not being offered right now because of COVID. But when it is, we encourage people, interested persons, to get enrolled in that academy because that's oftentimes the largest barrier to get over.
Thank you, Mr. Roby. We can all work on that.
And I think just doubling down on what you said, Ms. Prince, like we all do need to work on that because, if it's hard for people to look for these opportunities if they don't really know that they exist or what they might be. And because as council members, we have typically have opportunities to meet with so many community members I think that we are like kind of frontline for finding folks that might be a good match for these things. And so when we're helping fill up the pipeline, we get a great candidate pool as well. And this one is particularly challenging, as you mentioned, with the additional requirements before you can vote. So I think one of the great reminders as we go through these types of updates, which is typically what we do this time of year, is to think about the people we come into contact with and who might be a good candidate for these roles, and get that information into NOLNIX and to the departments as just candidates that we've been able to talk to and connect with out in our communities. It's all hands on deck opportunity for us. Ms. Jensen.
Hi, I just wanted to address that as well. So I met with Sarah and Travis several months ago for a pretty extensive conversation around these issues. And, I think that there's some short-term opportunities that we need to be thinking about, but really some of the long-term opportunities are around building that pipeline of people that can come in, but then also looking at some of the structural barriers that exist. So, for instance, right now, the police academy that you have to attend obviously is very long, but it's also prohibitive for somebody who, if you want to shorten it, you have to actually take time off of work. So when we talk about economic diversity, there's some significant barriers there. The other reality is that it takes, according to Sierra and Travis, it takes about 20 hours to review the cases that they have to review. And so it's a pretty significant time to participate as a full member of the PCR Commission. And right now, their reimbursement, which I know a lot of commissions don't receive reimbursement, but this one does. But the $50 reimbursement has been in existence since the inception of the commission, and that with budget cuts and everything else has not been able to go up. There hasn't been, up until now, a really fully established look that Julian will present his budget. I did put into my budget an increase in reimbursements, stipends for the PCR Commission, because there are serious issues with that. The other things that we need to be thinking about in the future are childcare issues, because the commission meetings are from 6 to however long it takes. And right now, if you are maybe a single mother and you don't have childcare, you can't technically participate because you can't, what are you going to do with your children? So Sierra and Travis, I think, would be so great to have some of their input and feedback, because really diversifying the commission is going to require some look at how people can, whether people can participate or not is not even just getting through the academy and the extensive background check. It's also the reality of how can I participate in a commission once I'm on it in a way that allows more diverse economically, and how can we get true diversity and access on the commission moving forward. So those are the things that we talked about and we're looking at through our new strategic plan. But those were some of the issues that the chair and vice chair raised to me to look at for building a pipeline and also bringing true diversity and access to the commission.
And I appreciate that comment. And I guess I want to make sure that we have a more global conversation about commissions and bringing people in, and how do we make them accessible to people, maybe as not necessarily just a part of this PCR conversation, but more broadly. I do think that we are learning through COVID that there are ways to conduct business that require less impact on people's lives because we can do things online. I was just thinking, I wonder if you could do the bulk of that police academy, which I did, and I thought it was very worth my time. But is there an opportunity to do the bulk of that online? Is there an opportunity for us to be able to watch recordings online? Can we do meetings where folks, their kids can just be playing around in the background and it doesn't interrupt their schedule? And those things, I think, are going to create opportunities to get folks involved that haven't been able to be involved before. You don't have to pay to park downtown. You don't have to find transit to get to someplace. So I'm hoping that we do capitalize on some of the changes that have precipitated out of COVID, out of necessity, but have turned out to be actually removing some barriers. Ms. Prince.
Yeah, and to that point, I think those are really good ideas. Also, Ms. Jensen, I'm wondering if there's a possibility because PCR is so much at the epicenter of what we are going through as a country in terms of police community relations since George Floyd. I wonder if there might be philanthropic opportunities or the Department of Justice or something like that that would provide funding to be able to compensate PCR, provide more generous stipends for participation on PCR, because I agree that in addition to that heavy load of training, that 20 hours per meeting in preparation that's a part-time job, and I think I'd be happy to help look into those kinds of possibilities. But I think that there might be a real chance of that now that we are facing these issues as a country.
Thank you. Thank you. And all right, thanks for that quick sequitur, Julian. We can head back to your presentation.
All right. So PCR, going into our data now. The PCR saw an increase in reviewed cases as well as allegations involved officers between 2018 and 2019. So you all can see we had 44 cases involving 72 officers with 52 allegations, 88 total allegations. So like an allegation, just to differentiate, it could be for a complaint, would be for a complaint case where it's like a total allegation. So an officer that relates to each officer. So an officer can have multiple allegations within a complaint case. For instance, Officer X can have a allegation of improper procedure as well as poor public relations in a complaint case, and it would be both would be fall into total allegations, but it would only be counted as one in allegations. Totally, we had 71 complaints. Of those complaints, 28 came through the HERO department, in which we have which we collect our demographic data. In addition to that, the largest share, there were no firearm cases reviewed by the commission. Therefore, that complaint data is omitted from this presentation and our annual report. Largest share of our dispositions. The largest share of our dispositions recommended for our complaint cases were unfounded and sustained. When a complaint is sustained, the commission recommends a disciplinary action, and they have a number of options available to them, including oral reprimand, written reprimand, suspension up to 30 days, demotion, termination, and in some cases, supervisory counsel. Furthermore, retraining is included but is not considered a discipline. It can be added to another discipline, but cannot be recommended as a standalone discipline. Of the sustained complaints, the PCR recommended termination the most. In addition, as Director Jensen mentioned, we talked about strategic planning last fall. In 2019, we had a strategic planning meeting in which the commission came together and created 3 different committees, an executive committee, policy research and recommendations committee, and community outreach and engagement committee. Our executive committee is comprised of the chair, vice chair, and potentially another commissioner. Their primary responsibility is identifying training needs for the commission, overseeing the rules, standard operating procedures, and bylaws. They also assist with grants, searches, and PCR interviews when we have vacancies. Our PCR policy research and recommendations committee is comprised of 2 to 3 commissioners not on the executive committee. Their role is to assist in research and review efforts of policies that the commission may want to see changed and recommend to the chief. And finally, our Community Outreach and Engagement Committee. They assist in developing and implementing our outreach plan that includes participating in events, tabling, community listening sessions, and connecting with underserved communities. Really, they primarily do a lot of the work when it's time to go to a festival or something, and we want PCR representation. Obviously, I will be there, but also people love to hear from a member of the board, and it's an opportunity for us to put a face with our commission that's making recommendations on these complaint cases. PCR successes. So as Councilmember Prince mentioned, in-kind donations from philanthropic sources. This past fall, we were awarded the St. Paul, Minnesota Foundation Community Capacity Grant. That funding was targeted towards a youth roundtable and a LEP summit, really some additional community outreach events. Due to COVID, unfortunately, both events had to be postponed, and we're planning towards holding these events over the next year in a more virtual setting, really to meet our present needs. We had to request an extension for that grant, which we were awarded last week. So we're working through what that actually looks like in COVID, being that when we were awarded the grant, we weren't anticipating that we would be in the middle of a pandemic. Furthermore, our SPPD in-service training. Last summer, the PCR participated in the in-service training of SPPD staff and employees, informing them of our PCR process. The PCR has worked with SPPD on outreach events, including Safe Summer Nights and National Night Out. We've invited them to highlight their work, including the Law Enforcement Career Path program, allowing them to table at our annual summit, and highlighted the mental health unit, now the community engagement unit, at our previous annual summit. In our upcoming summit, we're planning to highlight the new communication sticker program at the upcoming PCR annual summit. As I mentioned earlier, we appointed 4 new commissioners this past year. Virtual desktop interface. All the current PCR commissioners this spring and summer have been trained and are doing their case review in the virtual desktop interface on their personal machines and are no longer relying upon laptops to get the information and expedite the review process. We've been working on this program for a couple of years now, and this past June in our last meeting was the first time we actually used VDI fully to prep and go through our deliberations. We didn't have any hiccups, so we're hoping we have our meeting tonight and we'll be using it for the second time. We're hoping to go 2 for 2 with that process. Finally, policy recommendations. This spring, prior to COVID, the PCR was able to provide input and recommendations on SPPD policy 409.01. The PCR worked in collaboration with the accessibility coordinator in the HERO department. That new policy went into effect April 1st, 2020. One thing that's not mentioned on here is an event that it's not specific only to PCR. It's goes to the entire HERO, all the commissions and boards in the HERO department. We held an absentee voting town hall last week, which was led by the Minnesota Secretary of State. That was broadcasted on Skype, where we had our commission members as well as the public tune in and learn about absentee voting, vote-in mail for the upcoming elections. Areas of improvement. So our complaint demographics, this directly informs the St. Paul, Minnesota Foundation's grant fund and why we decided the youth town hall as well as the LEP summit. Based on complaint demographic, we had seen over the last couple of years that we were not seeing many complaints from youth as well as our limited English proficiency population. Majority of our complaints, when we're meeting with community members, we're meeting with community members, we're finding that a lot of this group does not know about the PCR. They're not aware how to file a process. They just they just don't know where to go. So and after meeting with students, going into a couple of classrooms, we decided that a youth town hall where we can talk directly with youth and get feedback from them, not just have them come to our summit and really meet them where they're at. We thought that would be the best way to go about getting them involved in this process. Like, how can we better serve you? How can we bring you in? What do you need from us that will make you feel more comfortable utilizing this process? similarly with our limited English proficiency group, we're not seeing that. So we're partnering with a number of, we're planning on partnering with a number of organizations that do work with our limited English proficiency in around St. Paul and the Twin Cities area to really bring these groups in and really see how we can better serve them, how we can bring them into this process, and what ways we can get their know that we can better understand how they're interacting with law enforcement, and really basically get an accurate account of what those complaints will look like. Additional funding. So we are in need of additional funding, as Director Jensen mentioned earlier, for support of our outreach efforts, marketing of the PCR, and we like to have a surplus of available candidates to serve when there is a vacancy. And we want people to be aware that we exist. We need to be marketed to the people of this city so that we can know where to file, so they can know where to file complaints, and that there's a process available to them. In the height of the George Floyd protests, it would be great if the city of St. Paul would promote the PCR in their messaging and encourage people to file complaints with the PCR in order to better inform people who may not know of the PCR process, but also that some form of social media marketing campaign would be nice to inform community of the PCR's existence. Additionally, we need training for the commission on various groups' experiences with law enforcement. Although the commission is comprised of various perspectives and lived experiences, there's 9 people on this commission, and we know that 9 people can't fully identify with everyone, and we know that some groups' experience with law enforcement is different, and it would be great if we could have funding to hire trainers from different organizations, for instance, like CARE, who do this kind of work to better inform our commission members. Additionally, there's a need for an increased budget to fund operational needs, including a line item for a private investigator, as mentioned in our ordinance 1649, Section F, should that become necessary. Under our current budget restrictions, that is not possible. Our PCR candidate pool, as Councilmember Prince mentioned earlier, the depth of our potential candidates to serve on the PCR is a concern, specifically for class, race, and presently gender, due to the multifarious time required to serve, including training that takes approximately 40 to 50 hours before you are eligible to vote, in meeting prep time ranging from 15 to 25 hours a month in order to participate in these meetings. A way to mediate this cost would be increasing the stipend, allowing some form of reimbursement, either through childcare or transportation. As presently constructed, it's very difficult for our different socioeconomic status community members to participate on this board, and their perspective is very much important and needed. The community survey. So the SBPD has a community survey, and we're very grateful that the community survey now has a link that directs participants to the PCR complaint form. However, we like to continue having that survey monitor for potential complaints that may meet the criteria of the commission reviews, including improper procedure, improper conduct, discrimination, poor public relations, and excessive force. And finally, virtual meetings. The inability for both commissioners and the public to participate in our monthly meetings remotely is a concern that's been brought up. We understand that there is a data privacy concern and that there should be some form, but we would like to see some form of accommodation made in order to allow for the public and commission members to participate in meetings, at least for the public portion, if not at least view them live without risking their health and safety in the midst of a pandemic. Under current restrictions, that is not possible.
And Julian, sorry to interrupt you again. I put this question to Ms. Jensen on the chat too, but is that something that is in our charter? Is it something, I don't imagine it is. Is it something that as a council we could work with you to change, or is that something that the state law requires?
For which one?
The prohibition of virtual meetings.
So when COVID first started, we reached out to SBPD, and we were informed that there are data privacy concerns, specifically around definitely for the private portion during case deliberations, for commission members, that if somebody someone may hear or maybe listening in a different room or something like that, and we open ourselves up to a data privacy violation. So that was the rationale that was put on the table why virtual meetings were not available to us. And we've had a commission member who has not been able to participate due to concerns around COVID in our last meeting.
Okay. Thank you.
And so, Councilmember Brown-Moen, I think that one of the things that we need to think about moving forward is, how do we work with legal and the St. Paul Police Department to either change or, figure out a way where we can do the meetings securely virtually. And right now we don't have that capability, but I do believe it's something that we should think about because, again, it's as Julian has pointed out, and one of my own personal concerns is, that really limits accessibility for certain demographics. And so we've got to think about that. But right now, because of the fact that it's personnel data, and there are concerns about that data being somehow compromised, we don't have a way that we can meet virtually for the majority of the meeting. But we need to be, moving forward, talking to the CAO and working with the St. Paul Police Department. And even maybe I've talked to the city attorney about what are the type of things we need to be doing both at a local level and obviously at a state level around the way that PCR is set up and the way that we have to conduct these meetings. So we are thinking about and working on that because I think it's, again, another broader issue that we need to address.
Great. And that would be a great check-in point for us at some point down the road as well. I don't know enough personally about the process or the rules, but even just thinking is there a way to redact information so that what is available is anonymous, but we still have the facts. It doesn't matter what somebody's name is when you're reviewing the facts of a case. It matters the facts around the case. So, can we make it private in terms of the personal piece? And so I think I'm glad you're looking into that, and we'll follow up with that in a future conversation with PCR. But it is just like looking at the slide of areas of improvement. It's wonderful to know that you're looking at these things critically and identifying places for improvement, identifying the places where there are barriers to making those changes. And that is where we can sometimes step in and be helpful, sometimes point you in the right direction. But this is a great update in terms of understanding what your challenges are. So I appreciate that. I think I cut you off again, Julian.
Oh, no problem. I was going to go into our future plans. So we have our annual summit. It was originally scheduled for April 22nd, but again, due to COVID, it had to be postponed. We are holding a virtual annual summit at the beginning of fall, end of summer. We're going to be sharing our summary data. We'll also be releasing our annual report, which has our the data that I presented earlier in this presentation in it. We like to utilize that that summit allows for us to connect with community, work on share the work of the commission over the previous year, meet the commission, share our plans, and collect feedback. Our current reality makes that a little bit not as feasible as it once was, specifically on collecting the feedback. So we're working to address some barriers in that new format, specifically around that community feedback in our breakout sessions, and really trying to think through what that can look like and make sure it's the best experience and most accessible for participants. Our youth town hall, the PCR, we had, again, with our St. Paul and Minnesota Foundation grant, we had those two additional events, the Youth Town Hall and the LEP Summit. We had initially planned to have that Youth Town Hall this spring and the LEP Summit this fall, again, both postponed due to COVID. And we're now with the extension, we are thinking through like how we want to do that and like which groups to, when would be the best way and what format would be the best way to hold that event. As of right now, tentatively, we'd like to have the youth town hall before the end of the calendar year 2020 and have the limited English proficiency summit at the beginning of 2021. But nothing has been finalized as of yet. As I said, we just got our extension last week and we're thinking through what that actually can look like.
I see Ms. Prince has her hand up.
Yeah, Mr. Roby, for the Youth Town Hall in particular, I'm wondering, are you working with the St. Paul Public Schools at all on getting the word out about opportunities for youth to be involved?
Yes, so that we were working with them this spring. We're planning on continuing to reconnect with them and get them involved for this event.
Great. And also, obviously, when you have dates, let us know because we can also use our networks to help promote those opportunities.
I will make sure to do that. Thank you.
Ms. Yang.
Sir?
Ms. Yang has a question or comment. Ms. Yang? Ms. Yang, are you muted?
Do you hear me right now?
Yep, I do now.
Okay, now I don't hear you all. Something's wrong with my mic. I'll come back to it.
All right, so, all right, let's move on while Ms. Yang figures out her technology over there. Mr. Roby?
Response to the George Floyd incident in Minneapolis. So after the events of George Floyd at the hands of Minneapolis police officers, the PCR, as well as the country, saw as the world went into unrest and protests erupted across the globe. The PCR, after being asked to sign a statement with the Hero Commission, elected to not make a formal statement or sign a statement, but we did stand in support of the mayor's statement in support of the peaceful protests. Although we did not make a statement, we were able to attend food and supply distribution sites around St. Paul and hand out some educational materials around the PCR and really do some limited community outreach for informing community members of the PCR and what's happening in St. Paul. I provided a link to the Hero Commission statement that was presented to you all earlier in June. I won't open that up right now, but I can send that out after this meeting to each of you if you haven't seen it.
Great.
And that's the end of my presentation. I can answer any additional questions you all may have.
Okay, well, let's see. It looks like Ms. Yang is back, so why don't we check in with her. Ms. Yang.
Thank you.
There you go.
Julian, I just wanted to say thank you to you and the commission for doing so much work and engaging our youth. I think that is so important, especially because, you know, they hold so much potential and engage so much in the community and don't often get a seat at the table. And so I wanted to just, learn a bit more about why that engagement, like why you all are really investing a lot of time and energy into engaging our youth and what you're hoping to get from that as well.
So what we're hoping to get out of that is really, well, one, we'd like to see just, I don't like to say increase in complaints because we don't want people to have negative encounters with police officers, but we would like to see an accurate account of what's actually going on. And we know that in the last 2 years, in 2018 and 2019, we've had 0 complaints from our youth, and we know that's just not possible. Based on national trends, but just also from the community outreach that we've done and the number of youth that we've talked to, explaining like how they've had interactions with law enforcement, but we kind of just don't know like, well, what is the barrier here? Like why are they not filing complaints? And like how can we bring them to the table that can make them feel most comfortable doing that? So our hope is with this youth town hall is that we can meet them where they're at. We can get some solutions directly from their mouths that would best serve them, and we can fully bring them into this process. And then hopefully we will actually start to get an accurate number and representation of like what's actually how they're engaging with law enforcement here in St. Paul.
Great. I have a follow-up.
Ms. Yang.
Thank you. And then would you be able to share what some of those findings are then in terms of like the engagement that you have had with the youth? Any like, I guess, the recommendations or suggestions that you are collecting from them?
Sure. So at the end of each of our annual summits, we collect feedback. Now in this virtual environment, that's going to look a little different. We'll possibly do like some type of survey at the end of the. Sorry, Mitra is requesting con.
Sorry, I clicked the wrong thing. I'll just unrequest myself.
Sorry. Yeah, so we'll utilize some kind of feedback to collect that information, and we'll publish that at the end of our meeting, usually in some form of document like these were the takeaways from the meeting, and these were the suggestions that have been put forward from whichever audience, in this particular case, youth, that they would like to see implemented.
Great. I see Ms. Prince's hands up again, and Ms. Jalali, were you trying to raise your hand or just, yes, okay. So Ms. Prince and then Ms. Jalali.
Okay, great. Julian, can you tell us, does the PCARC, I understand that the PCARC participates in the National Association for Civilian Oversight of Law Enforcement Conference, the NACO conference.
Yep, NACO, yep.
And so they have an opportunity to learn about best practices in a whole variety of areas. Is that right?
Yes.
What I wondered is, in the case of the police department best practices, I mean, the PCARC sees a lot in terms of how our police department is working, and then they attend the conference. And I just wondered if there is some opportunity, some feedback loop for them to be able to share what they learn and what they are seeing with the police department outside of cases that they're working on, so that they can directly speak with the department about policies and practices that they think might be able to be improved.
That's a good question. I don't have an answer for you, but I can look into that and get back to you.
Okay, well, it's a thought that I had that, they have a very specific job to look at the cases before them. But in that they are having these broader experiences and they are participating in a national conference, it seems like it would be worthwhile. Perhaps that could be at the forum or somewhere else, but for them to be able to share what they've learned with the police department to be able to potentially impact police department administrative and policy decisions. And the other thing I wondered is, are they able to do that with the general public at the forum? Is that an opportunity where they can share their learnings about best practices at that time?
So at the public portion of our meetings, usually after the NACO annual conference, the commission either in our chair's report or the HERO report, we give an update on NACO and like what that conference was, and it's shared among the commission all the presentations that they were able to participate in. I'm certain there's a way in which we can publicize that on our webpage, though, for the public.
Great. I think that the training that these commissioners have to become commissioners, and then the important work that they do that is so labor intensive, plus the fact that they're getting professional training through the conference, seems like they have a lot that they could share with all of us, including the police and the community, on how to make things work better. So thanks for that answer.
Ms. Jalali.
All right. Thank you. And I have to share that I laughed a little when I did my typo because I got a message that said, you did not get control. So I don't know. It just made me laugh for some reason on a Wednesday morning. Sorry about that. So I thank you so much, Julian and Director Jensen, for your hard work supporting the PCARC and just helping refine it over time. I wanted to kind of bring back up to just refresh a conversation that we had a little bit in bits and pieces throughout 2019 about the general public understanding the difference between like what gets initiated into a PCARC review process versus residents who pretty regularly interact with our offices or with different channels to just lift up concerns or feedback about the police department. And I'm specifically thinking of the page on the City of St. Paul website that says file a police misconduct complaint. And it's an exhaustive form that lays out like a lot of information, including information about the complainant, information about what they say happened. And that's one channel that people use. And then how does that data set connect to like what the PCARC actually gets to review, and how are those streams like the same and how are they different? Because residents are trying to give important feedback, especially in sensitive situations where there's power dynamics about reporting that an officer did something wrong or participated in misconduct. So can you clarify what, like how those things connect and what would be something that is squarely handled through PCARC? Do some of those ever come to that and just revisit that? I think it's important information and I try to regularly refresh it for myself too.
Certainly. If they're filling out the community survey on SPPD's site, that is not a complaint. However, there is a link to our complaint form. However, our request is that if they're filling that out, and we can't see those, we don't ever see those reports. But if they're filling it out and it meets the criteria of improper procedure, improper conduct, poor public relations, discrimination, excessive force, then we should see those complaints. Now, if they file a complaint that with our a PCR complaint on our webpage or through one of our community intake centers or through internal affairs, and it's a civilian initiated complaint, and as long as it meets the criteria, meaning that it's dealing with a St. Paul police officer, then and it has your name and signature, then the PCARC should review that complaint case. Now, we ask that the complainants fill out as much information as possible, but in order for it to become an official complaint and be reviewed, the complainant just needs to provide their name and a signature. All that additional information will be found out through while the investigation is going on. However, if they don't include either their name or signature, then there's no way to actually it's not considered an official complaint, and that's based on Minnesota state law. You are not allowed to file anonymous complaints.
Thank you. And so, I appreciate that. And so, building off that, if someone wanted to refer something to the PCARC, do they have the ability as an everyday resident to forward on that information, or does it have to get submitted somewhere and then determine whether it meets criteria for that? And I know there's a volume of things, and so we have to manage like what we get and how to make sure it's appropriately referred or not. But if an everyday resident wants something to happen based on something that the police did to them, like what channels could they go through to actually bring it to your attention?
They would need.
Yeah, sorry, go ahead.
They would need to file a complaint. They could do that online at our community intake centers or meet with me. I'll send them a complaint form. And they don't have to go through internal affairs. They can come through our office, and we encourage that. It helps for our demographic data, but it also we can actually track it. if a complaint is going directly to internal affairs or to SBPD, we should see that, but I can't fully guarantee that.
Okay, and I appreciate you clarifying that. And there's often an everyday experience constituents have of sort of just telling someone they know in the government and then feeling like a process is in motion. And I think it's all of our jobs in the government to keep to kind of help things find their way to where they need to, and helping residents find formal channels and understanding how we can work better with you all is helpful to me as an office, I know, and I'm sure to others. So I can follow up with other questions I might have, but clarifying that is useful for us. Thank you.
And it looks like Ms. Jensen, did you have something to add in terms of, or in response to that?
So I just wanted to bring up again, more of a global concern. One of the things that I think is really confusing and that we're looking at the director level is, if I live in St. Paul, I'm a resident, and I go to type in maybe, police brutality, whatever it is, right? Whatever the term is. It is really confusing for people that many people, at least my understanding from listening to different constituents and phone calls that I get, is that, the police have their own, website with their own feedback or complaint. And a lot of residents feel like, oh, well, I filed my complaint with the police department. Well, that's not the same as the complete process that we have through PCR. So I appreciate Councilmember Lally bringing that up, because at the director level, my concern is that there should be eventually one portal that people go to, that they then could be directed to the right portal for, if you have a complaint in the language that we use, it can be confusing. That the average person or resident like me, I may think I went to St. Paul Police Department to file a complaint, and then I find out later, because I get calls, that wasn't really the formal complaint. So what happened to my information? What happened to my data? And so right now there's a bunch of different portals out there. And I think it's really critical that we start thinking holistically as a city about, if I file a complaint with Councilmember Jalali, and then her person may get that complaint to Julian, which is great. But if that doesn't happen, then there's perception out there that the city's not being responsive. And so there is a bigger, question or issue around how do we centralize everything to make sure that people don't have to go to 50 different places to try and figure out how to file a complaint, because then the likelihood that they're going to be able to file that complaint is obviously much lower because of their dissatisfaction. So that's just my comment and what we're looking at broadly.
Thank you, Director Jensen, for that clarification. And I think so very true and very important in the work that we're discussing here today, and also so true for so many of our technological intakes of communication in the city. I'm looking forward to the day when you open up the city page and it's sort of personalized to you and comes to you instead of you having to search in for what you're looking for. And I know that those are kind of pie in the sky wishes, but it is sometimes just depending on which words you use, you end up in a different location to try to find answers to your questions, and it is a challenge. So thanks for clarifying that. Are there further questions today for regarding our PCR update? All right. And of course, as I often say, sometimes after the presentation, we come up with more questions. I know that Mr. Roby was going to follow up with one that he wanted a little more to dig into a little bit more. So we'll make sure that we can share questions we have and responses that come back in the coming days here. But we do appreciate this update, and really I feel like we have a little homework in terms of looking for folks that might be a good fit for PCR. I would encourage my colleagues and legislative aides, as I mentioned before, to consider the police academy themselves. It is a time commitment, but it's very, very interesting. And I hope that in this new reality that we can figure out ways to offer that course online to the extent possible. I know some things will always have to be in person, but it is a good opportunity. Okay, so I'm going to move us on. Thank you to Mr. Roby, to Director Jensen for your presentation here today. And we do have one more order of business. So if do you have any closing statements, comments from Hero or PCR before we move on?
I do not.
All right.
No,
Well, thank you so much. Thanks so much for being here. We appreciate it very much.
Thank you.
All right, I will turn things over to, I believe, Ms. Maloney.
Council President Brendan Mullen, I'm going to share my screen to show you. Is everybody seeing the screen there correctly? In a couple of months ago, when you passed Resolution 2788.
Trudy, I'm not seeing it yet.
Oh.
So I don't know if others are seeing it. I haven't quite, nope, I'm seeing some no's.
Okay. Just share. Hold on a second. Desktop. How about that?
Yep, it looks like it's coming up now, yes.
There we go. Okay, it's Teams, it's new. We're all learning.
It's new.
All right. So a couple of months ago, you all passed Resolution 2788. And among the things that the resolution said was you asked that council staff come back to you within 60 days with a proposed policy or process in which to handle resolutions or requests for resolutions dealing with religious persecution. And so I called out to Valerie Jensen and Rachel Tierney, and the three of us worked together and came up with the proposed process. So basically the process would be, the request would be submitted to me, and I would work with Hero and the city attorney's office, and we would get back to you hopefully within 30 days with a memo that gives you a little background on the topic, an evaluation using the criteria that we'll talk about in just a second, and also a recommendation to the council on how to handle that request. So when we look at the criteria, it's in two steps. The first step would be to ask the question, does this request violate the First Amendment? In essence, does it take a position on or endorse a specific religion or favor one religion over another? And if the answer is yes, then we are going to suggest that you not go forward with this request. If the answer is no, then we're going to look at the following criteria. Oh, there. Okay. So there are about 6 criteria that we're going to look at. Does it have a council member sponsorship available? Is the request coming from a St. Paul resident or a nonprofit that's located in St. Paul, or that a majority of the members are located in St. Paul? Does it align with the city's legislative agenda and policies? And does it contemplate ongoing involvement of the city with the religion? And then is the outcome to champion justice and equity by confronting issues of discrimination and promote innovative avenues for accessibility and economic opportunities for all residents and businesses? And then finally, are there any negative or unproductive ramifications from passing this resolution? So we would take a look at all that criteria and then get a memo back to you for you all to decide what to do with that request. That's the proposed process.
Thank you, Ms. Maloney. And this, again, was the follow-up from the resolution that we passed asking for the council to work in concert with HERO to come up with some guidelines around these types of resolutions. And we're just checking back in before this is codified into a resolution. Whoops. Whoops, I just dropped off for a second. Am I back? Good. Yep. Okay. So at any rate, I'm just looking to see if there's any feedback on this before we move ahead to creating a resolution format of this. I'm looking to see if folks, Ms. Prince.
Thanks so much to Ms. Jensen and Ms. Maloney and Ms. Tierney for your work on this. And my immediate reaction is positive. I would just like to take a little bit of time before it goes on our agenda so I can get feedback from a couple of human rights groups in the city to just see if they have any suggestions about it. But I think that I think it's very helpful. It's good work, and I appreciate that guidance.
Great. And as to the point of some time to ruminate and share this with others and get feedback, I think we wanted to just pause here, make sure this was on the right track, and I think it really does look good. I know that not all of our colleagues are on the meeting today, and I believe Ms. Naker had mentioned wanting to even make it a little bit more global, just a step beyond just religious persecution, but perhaps other resolutions that were more symbolic in nature that gave us some guidelines for what to move forward with or what other processes to look at. So I think I would second your thought about giving it a little time before we move forward with a formal resolution, but I'm just mostly checking in and making sure that this is the right direction, and that I think that we've got some valuable insight between the information from HERO and from our city attorney's office to get us off in the right place, but agreed on some time to think about this before it is passed formally. Other thoughts, Ms. Yang?
Thank you. I do think this is a really great first draft, and specifically because I feel it really captures a lot of the concerns that were brought to us when we were deliberating about the resolution that we passed a few months ago. So I think you all really centered that. So I want to say thank you for doing this work.
Great. Thank you, Ms. Yang. I'm reminding colleagues that when I'm looking to the hands to help me know when you're done with your follow-up questions as well. So when you're, keep your hand up while you're still asking questions, and then when you're done, then we'll know you're done because your hand is down. Other thoughts on this first pass here? Great. Well, that's usually a sign that we're off to a good start, and the work's in a good place as we get ready to move forward. So I think we'll plan to bring it back in front of the council in the next 3 to 4 weeks in a more of a resolution form. And then, of course, that would go on the agenda to pass, so it would have another opportunity to be seen and viewed by the public. Okay. If there is nothing else on this topic, these are the items on our agenda today. So we've reached the end of the agenda. And we will be adjourned until our next meeting today. So thank you very much for folks who participated, and to my colleagues for this first run at Teams council meeting. I think it went well. All right, see you later.
Thank you.
We're adjourned.